Self-Management Week. ALISS in action. Amber Sharif, ALISS Engagement Officer, The Alliance. Follow us on X at Self-Management Scot and Alliance Scot.
If anyone has any questions, I'm happy to answer them as we go along, or I can take questions at the end too. You can also pop them in the chat box as well. So what is ALISS? As I mentioned, it stands for a Local Information System for Scotland. And the ALISS programme helps to make local information more findable with the help of local communities, organisations and professionals. It was originally co-produced with people who are disabled, living with long-term conditions and are unpaid carers. So we asked them what was most important to them in terms of their health and well-being and what barriers existed. So it was concluded that there were many different local supports and services that helped them to stay well, but it was often quite challenging to find this information, either because it wasn't published online and it was easy to miss, such as leaflets or word of mouth, or that even when it was online, it was very hard to find and in lots of different places. So that's how ALISS came about. We tried to create one list of all the different supports and services that were important to them, but also what we wanted to make this one list available through a variety of different places that were familiar or accessible to them. So you can see here, listed here are the different supports, groups and services that are available on ALISS. So it's important to note the wide range and variety of groups or services that you can add, as long as they're there to help your health and well-being. So examples here include support groups, helplines, befriending services. We've got community gardens, advocacy services. So yeah, it can really be a whole range of things. It's a really great signposting tool. Quite often when you're supporting someone with one particular issue, there could be quite a few other supports that come up that you think that they require. And that's where ALISS can be a really good tool. And again, it's ties in with self-management as it's about tackling issues holistically. Currently, if you would like to add a service, you have to have a basic account. That's the top one there. So you can, if you want to just browse ALISS, you can do it without an account. A basic account is a very simple process. You just sign up with your name and your work email and create a password. So if you haven't done so already, I would definitely recommend signing up after this. A basic account is great for the general public who may only want to browse services or add one or two listings themselves, as they will then need to be approved by our team. If you're an organisation or professional and you'll be adding quite a few listings, or you would like to kind of have ownership of them, then an editor account would be better. So that's the second one there. And all that we ask to have an editor account is that you run through a simple training session with us on how to add a listing to ALISS. Also, when you go on ALISS, you might notice that some of the listings have a blue claimed badge next to them. So this kind of works like the Twitter, the tick on Twitter or X to show if they're verified. So claiming your service allows those that share their information to have ownership of that information, and it also prevents other people, other users on ALISS from editing it. So it doesn't give you extra work, it just means that no one else can change it. And for users, it helps make different services and groups more legitimate and more trustworthy. As you know, it's a verified group or organisation. So as I mentioned before, we wanted to make this information accessible to everyone. So we don't just want people to use our website, we want to have it on a variety of different databases. So you can currently pull the data from ALISS and put it on your own website. So some examples here are the Glasgow Community Food Network at the top there, NHS Inform on the Health and Wellbeing Directory. All of their information is pulled through from ALISS. There's also been other councils and TSIs that have been using our data, such as Shetland Community Directory, East Ayrshire, Aberdeen City Health and Social Care Partnership. So it's great. It's reducing duplication. It's exactly what we want. And yeah, so it's definitely, if that's something that you think would be handy on your own website, then please get in touch with that. So thanks very much for listening to my presentation. I'm going to go on the website now and just show you how to make a search and some of the features as well. I put my details on here and our social medias as well. So I run longer ALISS training sessions. So if you think you or your team would be interested in more information, then please just get in touch. So this is the ALISS website. It's aliss.org. This is what the homepage looks like. And currently you can search by where. So you could type in a city, a postcode, or an area in Scotland. You can also search by what. And so this is more if you know exactly what you're looking for specifically, such as mental health support or transport. You can also search by just generic categories here. So at the bottom, you can scroll through. We've got community resources, digital, education, and so on. A few important documents and links at the bottom here. So we're currently on Alexa. If you click this link here, it will take you to how to download the Alexa app. And yeah, this has been really great for a lot of people who maybe are visually impaired or really rely on Alexa. So that's been a really good tool for them to have. We also have a link to our help center. And we've created lots of different guidance videos on how to navigate ALISS, how to register, how to add to ALISS. So yeah, if you're on the website and you're stuck, I would definitely check these out. We've tried to make it quite simple and easy to understand. And another important tool that we have is the accessibility tools. So if you click here, it comes up with a Reach Deck toolbar. And this is such an amazing tool that we have. So if you click on the question mark here, it will show you what each icon does. And yeah, it's got some amazing options. So it can read the page out loud. It can read selected text that you highlight. It can provide written and spoken translations in multiple languages. So if I click on that here, you'll see how many languages it can translate ALISS into. It can also read it out loud. And this is so good if you're supporting someone where English isn't their first language. It also kind of summarizes the text for people that are dyslexic, it enlarges the text. So yeah, this is really good, and I would definitely recommend showing it to people when you show them ALISS. And then, so I'm logged into my account currently. So you have your dashboard, and that's where you can access everything that you've added, like your organizations, your services, your claims, like the verified tick that I mentioned. So I'm just going to show you how to make a search quickly. So I'm just going to type in an area in Glasgow. So I'll just type in Shawlands, Glasgow, click search. So you can see that there is a lot of results right now, and you don't really want to be going through all of them. So this is where you want to filter them down. So there's many different options on the left-hand side of the page to filter them. So currently it's sorted by distance. You can also select last updated or A to Z. You can also customize a distance if you want it to be really close. People don't have access to transport, or if they're able to drive, then you can select that. The categories is the main part where you're going to really filter down your results. So you can see here we have lots of different categories, and within them we have even more categories. So you could click activity. I mean, you can see here it has creative, physical, or social. You could then click social, and it goes further down if you want into these options. So if you were specifically looking for a social group for someone that you were supporting, you can see now there's only 125 results, and it's sorted by distance. So we've got lots of different options here. You can, yeah, so you can click more categories there. We also have accessibility features, and this is really really useful if you know that someone really requires a specific accessibility feature, like an accessible toilet, for example. You can also click a WHO category. So if you are specifically supporting unpaid carers or ethnic minorities, you can click that here. So I'll just go on to one of the options here. So we've got Health Walk, Bella Houston. So you click here and it will always have it delivered by, and that's the organization or the group that is running it. And it will also say last updated, which is really useful because we want to make sure that people know when it was last reviewed. We send them yearly reminders, but yeah, that's just good to know in case it hasn't been updated in a while. It will always have a summary of the group here, a map as well, showing you exactly where it is and directions to it, and then the categories. And then it will always have a piece of contact information. So we've got the website, a number, and an email. It will sometimes have social media too. And then these actions are really useful to use. So you can share this page via email, and that doesn't come from your own email, it comes from the ALISS email. So again, really good for if you're supporting someone. You can also print this out if you are trying to give it to someone who doesn't have access to the internet. You can also add it to a collection, which I use quite a lot. So you have to have an account for this, but you can create a collection, add it to there, and save it. And when you go to the collection, you can have all of these, and you could either email the whole collection or print it. And so you could create collections for a specific person or a group of people that you're working with. So yeah, that's a really good tool to use. So I'm very conscious of time, so I'm going to stop there.